Okay, Assalamu alaikum. Good morning to everyone. Today I discuss very interesting topics that in obstetrics, the pregnancy is important. Okay. Important topics. Okay. What is pregnancy? Anyone? Conception. It is fertilization of ovum and spermatozoa and formation of zygote, and from zygote the production of fetus, then placenta, amniotic membrane along with amniotic fluid, and where it is grown up normally in the uterine cavity. So pregnancy, what is obstetrics? What is obstetrics? Is the subjects who deals with pregnancy, delivery, puerperium, its management along with complication of its management. Discuss the physiological change during pregnancy. Otherwise, you cannot understand what is pathology. Understand? If you do not know the anatomical, physiological, biochemical changes during pregnancy, you cannot understand what is normal, what is abnormal. So this topic is so important to us. Okay. Now, anatomical changes during pregnancy. What changes in the anatomical? So, in reproductive organs, normal anatomy of the vulva, vagina, cervix, uterus, fallopian tube, ovary, peritoneum, and along with the breast, all change, markedly change. But all other organs, suppose cutaneous, all other organ of our body, what are all other organs? All other organ of the body is affected. The skin changes, you see the other alimentary system, respiratory system, metabolic system, and cardiovascular system, renal system, all should be changed. Otherwise, adaptation cannot be occurred. Changes is for what? For the need of the body, for the need of the mother, for the need of the fetus. So there is change. So what are the changes now? At first I want to mention the anatomical change. Anatomical change is what is? If we start the vulva, and how it is changed actually due to continuous production of hormone from the placenta. At first, up to 8 weeks, corpus luteum of pregnancy produce the hormone, and after that it is hand over to placenta. After 8 weeks, corpus luteum of pregnancy hand over its function to the placenta. So placenta, what is structure? Main structure is syncytotrophoblast and cytotrophoblast. Stem villi, all mainly syncytotrophoblast and cytotrophoblast, all continuously producing the hormone like estrogen, progesterone, human placental ectrogen, like this. All the growth hormone is that is human placental ectrogen. Is growth hormone like function, then other pituitary hormone like function, hypothalamic like function. In our body, hypothalamus, pituitary, all are produced what? Hormone. So these not same, but hormone likes hypothalamic, pituitary, all hormones are produced from the placenta. Why it is formed? Due to growth and development of the fetus. And there is interaction of the fetal organ, maternal organ, and placenta. The fetus, placenta, and maternal. There is correlation in between this. Suppose in the formation of the estrogen, this is interaction between fetus, placenta, and mother. So there is always changing and continuous production, and hormone also excreted to the urine of the fetus and urine of the mother. So now the changes in the vulva. The normal anatomy of the vulva. What changes? Increased vascularity. There is more vascularity and more cardiac output. 40 to 50% cardiac output increase during pregnancy. to supply all the organs to meet up the demands of the body. So increased vascularity changes the structure of the vulva. What structure of the vulva? The skin, subcutaneous tissue and blood vessels. So increased vascularity causes edematous. Sometimes the varicosity, you heard the name varicosity? Local dilatation of the vein. So varicosity, edematous, softening and other changes. Suppose color changes, pigmentation, all are due to hormone production during pregnancy. And after that, vagina. What is vagina? It has normal size and shape. Due to increased vascularity, there is hypertrophy of the vaginal structure, all the structure, and there is increased vascularity. So there is rugosity increases, length increases, vascularity increases. If there is vascularity increases, there is congestion and there is color change of the vagina. Normal, the color, it is changed by due to increased vascularity. Understand? Darkar ase? It is needed. Yes, vaginal length to soften, to relax, to enlarge, it is needed to come out the baby through the vagina. So it is needed. Okay? And then cervix. Cervix, what should be changes in the cervix? It is very interesting. Cervix, in our body there is so many defense mechanism. The defense mechanism of our body. Vulva, there is inherent property of the vulva, keratinized, and it prevents any infection. Increased vascularity prevents. If any infection, it tries to overcome the infection. And apposition of the labia, that is also important for defense mechanism. Vaginal, what is vaginal pH? Acidic. Why? By the production of the dorsal bacilline on the glycogen, it continuously produces lactic acid. Why it is important? Lactic acid destroy any organism, any abnormal organism destroy. So there is increased acidity and increased secretion of what? Acidity also more in the secretion. In the vagina there is any gland? No gland. But from the glycogen and by the bacilli interaction, there is shedding out of the epithelium and also transudation of the some fluid from the vaginal epithelium. Okay? And then cervix. Cervix is racemose types of gland. There is continuous secretion and during pregnancy there is more secretion. Can you follow my class? Am I rapidly or rapidly? I am processing more rapidly or what? I think this is basic knowledge, so I will be faster, okay? And cervix is racemose type of gland, there is more secretion, more vascularity. So cervix is, you feel the tip of the finger on the nose and lip. Is the difference between nose and lip? It is softer and it is more firm. So normal pregnancy, without pregnancy, it is like nose and like lips during pregnancy, softer. It is softer, color changes during pregnancy, the cervix. Okay, why? Increased vascularity and edematous. Okay. Then more secretion of the gland, which causes mucosal plaque. There is a plaque formation in the cervix, so that no ascending infection through the cervix. Understand? Now, cervix, the structure of the cervix. Internal os and there is external os. And anatomical and physiological structure, the histological structure. External os is stratified epithelium. Internal os is columnar epithelium. There is a transitional zone. And then just below the histological os, there is what is isthmus, the isthmus region. And isthmus region undergoes 3 to 4 times growth and development to form the lower uterine segment. You heard the name lower uterine segment. Where we do cesarean section? In the lower uterine segment. It is formed from the region of the isthmus and it is masked with the structure of the uterine cavity. So there is a short note in lower uterine segment. Short note. So it is formed from the region of the isthmus. How? Due to hypertrophy and hyperplasia of the structure of the cervix. আন্ডারস্ট্যান্ড? কীভাবে বড় হয় আমাদের মাসল যারা বেশি কাজ করে কীভাবে বড় হয়, এগুলো বড় হয় কীভাবে সব কিছু? হাইপারট্রফি অ্যান্ড হাইপারপ্লাসিয়া। ওকে, and due to hormone production and also due to stretching. Okay, then the body of the uterus and then fundus. Fundus grow more faster than the body. You see the uterus normal. What is the length of the uterine cavity and weight of the? Only cavity 7.5 centimeter, but it is increased over 35 centimeter. How miracle! It is miracle. Pregnancy is the miracle. The changes, all changes, and then again reverts back. So it is gift from Allah, and Allah knows everything. Only we study, we imagine. So you see the adaptation. You see the hen and other birds before eggs or before give birth any babies. Their growth and development is more fatty deposition, more protein, they eat more. Like all the animals are like this. During pregnancy, all animals like this. Human being also in that way. So there is more weight gain. There is more weight gain. Now come to the uterus. Uterus is actually 7.5 centimeter and shape is piriform shape, like pear shape. But when it is grown up to 6 weeks, it is pear shape. Then it is up to what you wrote. You can you remember what I am saying? You try to write also something. So it is sometimes writing and listening not problem, cognitive function problem. So okay, better listening is better. Okay, and pear shape 6 weeks, and then 8 weeks pregnancy, it becomes orange shape, just like orange shape. 8 weeks pregnancy, round orange shape. And after that it is grown up, and then cylindrical shape, pyramidal shape, and then lastly it is ovoid shape. So in different stages of pregnancy, the size and shape of the uterus is changed. At first normally pyriform, that is pear shape, then orange shape, then again round shape, and then cylindrical, and then ovoid shape. All written in the books, your datta, that is you follow the datta. Okay, so changes. How? So you can imagine how it is changed, how it is. Suddenly, what supply, blood supply needed, protein needed, metabolic function needed, biochemical changes needed. All changes should grown up the uterus. And inside what is the fetus. So now again come to us the uterus. As you can remember the structure of the uterus. What is endometrium, myometrium, perimetrium. In the myometrium, and all three structures are changed. Hypervascularity, more secretion, and thickness change. Muscle is more important. Bone hypertrophy and hyperplasia. There is more hypertrophy of the muscle, so that it is enlarged. And so that is important. How it is enlarged? So there is smooth muscle, hypertrophy, and hyperplasia due to hormonal effects and stretching. From the inside there is fetus, so there is stretching always. And now normally weight of the uterus how much? Non-pregnant how much? 50 gram. And cavity, but in pregnancy at term it becomes 500 gram. And normal vascularity suppose 50 ml per minute, but during pregnancy the blood supply to the uterus increases 500 to 750 ml per minute. So can you imagine how much vascularity to the uterus? Why there is bleeding after delivery, why there is postpartum hemorrhage. Okay, now I am telling you the anatomical change. Now the changes in the fallopian tube also, there is due to vascularity and stretching. The anatomically it is transversely placed, but when uterus grown up, it becomes vertical. Understand? And fallopian tube no role, so there is no need of such growth and development. It becomes vertical. Changes in the round ligament also, because stretching, there is some elongation. And other things. So I tell in short the changes in the female reproductive organs. Okay, now I go to the systemic changes. Suppose breast changes is so important, as change at first changes in the breast that we can imagine clinically she is pregnant. Before there is no hormonal assay, we cannot do her pre-pregnancy test. Then clinically we understood the changes in the breast. The breast structure, imagine nipple, areola, and the other structure, remaining structures, stroma, glands like this. So inspection, what we see, the areola, it become pigmented and more darker, and enlargement of the alveoli and the ducts affected by estrogen and alveoli affected by the progesterone. So there is growth and development of the duct alveolar system, and there is color changes of the areola and the nipple, more erected. Is possible some secretion from the breast? Can you follow my class? Yes. Is any secretion possible from the breast? Of course, there is secretion. Secretion why? There is a glandular system, ductular system, so there is a secretion. And there is thick, some pregnancy, there is some secretion. And ultimately this secretion at term what becomes, it is known as colostrum, very good, rich in immunoglobulin like this. Every secretion has some property, something there is. To naturally, in each secretion there is something for protection of the body. Okay? In our body, the creature of Allah, nothing created unnecessary. There is something behind this.